Okay, so I'm just gonna do my room scan. Okay, I've got my supplies. This is my physician's orders. I've got supplies all here. Okay. Hi, my name's Danielle. I'm going to be your student nurse today. Can I get your first and last name and your date of birth? Alright, I'm verifying with his wristband and provider's orders. So it looks like today I'm going to be drawing some blood for lab and doing a dressing change. Is that okay? Alright, I'm just raising the bed to get at a comfortable height for me. And I'm going to get you comfortable here. Okay, I'm just gonna try and get this closer. Maybe I can go like this. It's just like that glare. I'll just do that. Yeah. Okay. I'm just going to get my table and everything ready. Looking at provider's orders, I'm going to be drawing some blood and changing the dressing on your central line. Is that okay? Alright, so if he had any fluids running, I would stop them, but he doesn't. And do you have any allergies, Joe? Just the sulfa. Alright, that looks about right. I have provided privacy, performed hand hygiene. Okay. So, first, I'm going to put some gloves on as I just performed hand hygiene. Oh crap. Can't really see this very well. Right? Oh, that's better. Okay. Putting on my gloves, I'm going to open my hub here, and I'm going to attach my heparin that I've verified with MAR, and I got the air out, so I'm just going to attach that and then prime so that it's ready to go once I am done. So now, just bring my supplies closer. I'm going to scrub the hub for 1 minute. Alright, 1 minute has passed. I'm going to grab my first flush. Attach. I'm going to unclamp my line. And checking for patency, and the line is patent, so I'm just going to use the push pause method. Using the push pause method, I am going to flush with 10 ml. Okay, now I'm going to draw back 10 ml to discard. Okay, and set that to the side. I'm going to grab my empty syringe for lab, and they need 7 mLs, 7 to 10. Okay. And then I'm going to flush again with 10 ml using the push pause. Now I'm going to clamp the line, and I'm going to twist off this blue cap. To put a new one, since I just drew blood, I would screw that on, making sure it's not tight. Okay, and then I would unclamp, and I am giving 10 ml of heparin, and I already did my checks with the MAR. Okay, going to clamp that and unscrew it, and I'm just going to put these aside here. Just so that it's out of the way. Okay, now I'm going to take off my gloves, perform hand hygiene. Joel, for your dressing change, I am going to have you wear a mask. I will be wearing one as well, and just turn your head away so that we don't contaminate your central line. I'm going to open my kit, my sterile dressing kit. I'm just going to throw this away. I am going to open it. Here are my sterile gloves, and then my mask. Now I'm just going to open my sterile field so that it's ready. Now I'm going to, without turning my back, I'm going to perform hand hygiene and grabbing my gloves so I can take off this old dressing. Okay, I'm going to carefully take off the old dressing. And I'm looking for any signs of infection, like swelling, redness, odor, any drainage, and there isn't, and that looks good. Taking off my gloves and discarding that. Before I put my sterile gloves on, I'm going to grab my Tegaderm, my sterile Tegaderm, and place it on my field, making sure not to reach over it. Okay, I'm going to open out my sterile gloves. And I'm going to carefully put them on. That can be discarded. Okay, so now I'm going to just get this ready. I'm going to just fold this out open so that it's ready for me. I have my wipe and my label ready to go. I'm going to sacrifice this hand holding this, and I'm going to scrub this side, making sure not to overlap. Alright, and I'm gonna go up one time and discard. I would make sure I don't put my hands below my waist. I'm going to carefully pick up my Tegaderm and take off that. Kind of just like drop it. And now that it's on, I can take off the edging. Maybe. There we go, kind of. Okay, let's just pretend I took that off. I'm going to take off my sterile gloves and perform hand hygiene. Is there anything else I can do for you today, Joe? Alright. I would make sure I label my dressing with my name, date, and initials. Initials, date, and time.